of her in any way. The House of One in Faith is free and confidential. For more information, call 352-687-8895.
All right, 20 minutes after 8 o'clock. Nice looking Tuesday morning. Hope you're doing well. There was a story in the news. I just saw it this morning. I don't know if it's a new story or not, but it was about a medical procedure in New York. Surgeons separated 13-month-old twin boys that were conjoined at the head, and it looks like it was a successful operation. It took 16 hours for surgeons in New York City to separate these two boys. There was talk about the fact that the doctors perhaps knew that this was going to be how they were born before they were born. And could this surgery have been done before they were born? And would it have been any easier to do at 13 months old? Their bones in their head, their skulls were, I guess, a little more solid than they would have been. I don't know. Dr. Scott Adzick is on the phone. Dr. Adzick is the surgeon-in-chief at the Children's Hospital of Philadelphia, and he's the director of the hospital Center for Fetal Diagnosis and Treatment. This is a fascinating it's a fascinating world. He's talking to us about the advancing technology of fetal surgery. Good morning, Dr. Adzick. Good morning, sir.
Good morning to you. And of note, the largest experience with separation of conjoined twins is here at the Children's Hospital of Philadelphia, and I've been involved in a whole bunch of twin separations. And most of them, as you implied, are diagnosed before birth by ultrasound.
So what is the better way to handle that? Is it wait till the babies are born, or to do it before they're born, or what is the best way?
Well, we have to wait till the babies are born because there's a whole bunch of steps that need to be done prior to doing the separation in terms of diagnosis, to get additional tissue with tissue expanders and so forth.
Yeah, I didn't mean to throw you a curve and bring something that you might not have intended to talk about, but since it was in the news and we knew you were coming on, I had... can I just ask one more question about that?
Sure.
Are your patients, the parents of your patients, ever faced with making a decision, keep them conjoined, or knowing that one of them would die? Is that sometimes a choice?
Yes, it is true that in some cases, neither twin can be saved. For example, if they have a conjoined heart that's very complex and deformed, or in some cases, one twin can be saved. And then we hope that there are most cases in which who survive gestation, both twins can be saved.
Wow. So how long have we been able to do, or have you been able to do, we don't do anything, how long have you been able to do fetal surgery? Is that a relatively new procedure?
Well, it all began about 30 years ago. I'm a pediatric surgeon, and I was frustrated in taking care of babies with life-threatening birth defects where there was ongoing damage, organ damage before birth, and when the baby was born, we were too late. And so that led to the impetus for the consideration, now that we could diagnose things in the 80s by ultrasound, to consider doing repairs before birth, which was an outrageous concept. We did work experimentally, largely in fetal sheep, and then worked out the details technically, and then started to apply this in the late 80s. And as for the Spina Bifida problem, which we're going to discuss, really it was only 20 years ago that we considered treating this non-life-threatening but potentially devastating birth defect before birth.
Okay, so Spina Bifida is the focal of this interview. What is that exactly? What is Spina Bifida?
Well, that's a particularly topical question because October is National Spina Bifida Awareness Month. So spina bifida is a birth defect in which an area of the spinal column doesn't form properly early in embryonic life, leaving a section of the fetus's spinal cord and spinal nerves, those delicate nerves, exposed through an opening in the back. And the higher the defect goes on the spinal cord toward the head, the more nerves that are affected. It's the most common birth defect of the central nervous system. It affects about 1,500 babies born each year in the U.S. That's about 30 per week, about 5 per day. And we found that by treating the spina bifida before birth, by operating on the baby prior to 26 weeks gestation, we could close the defect and prevent ongoing damage that occurs from amniotic fluid exposure. Amniotic fluid is mostly fetal urine, and that has devastating neurotoxic consequences on the exposed nerves.
Oh, my goodness.
So you close the defect before birth, you can preserve neurologic function, and the outcome in many cases is no paralysis of the legs, the ability of the child to eventually walk, and a decreased need to drain fluid from the brain because of decreased incidence of hydrocephalus after fetal repair.
How do you numb the area that you're going to do the surgery on while the baby's in the womb?
Well, it's probably worthwhile to think about what actually goes on. So we do about one of these a week now. The mother goes to sleep under general anesthesia. That anesthetizes her, and through the placenta anesthetizes the fetus.
Oh, okay.
It also relaxes the uterine muscle, because we can't do the operation if the uterine muscle is tense. She has a sideways wound made in her lower abdomen. The uterus is exposed. We invented a uterine stapling device that fires absorbable staples, and that makes the cut that's about 3 inches in length and keeps the membranes around the baby tacked up to the muscle layer of the uterus.
My goodness.
Spina bifida is then exposed, and then we do the closure, and then we close the uterus watertight, and then we close her abdomen, and then she's treated with medications to keep her out of preterm labor. The average hospital stay is about 4 days, and then she's followed closely for the rest of the gestation, and she needs to have a cesarean section for the fetal surgery pregnancy and for all subsequent pregnancies.
Oh, okay.
Wow.
So from that point on, all of her babies will be cesarean. Am I saying that right?
Gosh.
But the good news is that the children are healthier than they might have been otherwise.
Yeah, it's important to be open and honest with the families, and to be clear that while fetal surgery for spina bifida is not a cure for spina bifida, it has the potential to dramatically improve the patient's life. So we have children who, if they had been treated after birth, they wouldn't be able to walk, they'd be wheelchair bound, and they'd have to have a shunt tube placed for hydrocephalus, for fluid on the brain. Whereas those who are treated before birth have a high likelihood of being able to walk, and a decreased need for that shunt tube.
You're in Philadelphia, and I know you guys are known for like one of the key places in this country. Do we have that? Can doctors here do that procedure, or would a lady with a baby that needs this procedure need to go to Philadelphia?
Categorically, they would need to come to Philadelphia.
Okay.
Is there any chance of brain damage for the baby when the operation happens?
No, the baby is anesthetized and is closely monitored, and the point of the operation is to preserve the nerve function and also to prevent hydrocephalus, which can cause brain damage. So by doing the operation and mitigating the effects of hydrocephalus, you can avert brain damage.
The more we talk, the more questions we have, and we only have a minute. So can I ask you to give us a website maybe, or another resource so that listeners can get the information they really need?
Yeah, listeners can learn more about Children's Hospital of Philadelphia, or CHOP, at fetalsurgery.chop, CHOP.edu. That's fetalsurgery.chop.edu.
Okay, well...
one more thing.
Go ahead. I'm sorry.
Is that most recently Children's Hospital of Philadelphia was the focus of a 3-part documentary series put out by PBS called Twice Born, Stories from the Special Delivery Unit, that followed just 4 of our patients. We see about 2,000 a year, and one of them had the spina bifida repair before birth. And of note, this series, we just learned, won an Emmy for outstanding science and technology programming last month.
And gosh, that kind of a program is what should get Emmys.
Yes, for sure.
Doctor, thank you for being on the air. We've recorded this, and we'll make sure we put the website up with the recording when we share it on Facebook and YouTube. Thank you, Doctor.
Thank you very much.
We'll be right back.
Comments from the FBI. He told a crowd at a rally in Wisconsin.
The Undersecretary of State, Patrick Kennedy, illegally pressured the FBI to unclassify emails from Hillary's illegal server.
Donald Trump is anxious to find a topic on which he can change the subject away from the news.